Hi, I'm Dr. Steve Lucey. I am an orthopedic surgeon, board certified and fellowship trained in sports medicine and joint reconstruction. I focus most of my practice on knee surgery, knee arthroscopy, ligament reconstructions, partial knee replacements, total knee replacements, revision knee replacements. Do a little bit of shoulder and hip, a lot of non-surgical sports medicine care. One of the reasons I chose sports medicine was because I've had a lot of history with sports and sports injuries. I think I've had most of the sports injuries that I treat today. I've had at one time or another myself, and grew up playing sports. It was a different day then. I played every sport that was in season. I went to Clemson and played soccer, which was sort of my dream as a little kid. They were a great team and have been great for a long time. First year I was there, we won the national championship, which was special, obviously. The second year I was there, we won the ACC championship and almost won another national championship. And then I tore my ACL. Took a little while to get over that ACL injury, set me back quite a bit, but it did sort of help me refocus on the fact that soccer was not going to be my career. And so really getting into medical school had a lot to do with that refocusing that took place. So went to medical school at the Medical University of South Carolina in Charleston, did 5 years of orthopedic residency at Winston-Salem at the Wake Forest University Baptist Medical Center, and did my final year of training in what we call a fellowship year in Manhattan, where I worked with the team doctors for the New York Knicks and worked with an individual who actually invented knee replacement back in the late 60s, early 70s, and so really my goal was to spend a year with him since he's considered the best knee surgeon in the world. Working with Dr. John Ensall was a gift. He only selected 4 people a year. He invented or described 90–95% of the procedures that are done on the knee today, including ACL ligament reconstruction, partial knee replacement, full knee replacements, and many of the other operations. He figured them out. So he was an amazing, amazing man. And so my goal, because I had a draw towards knees, was to go work with the best. And I was fortunate enough to do that. I serve as the one of the 2 orthopedic surgeon team doctors for the United States women's professional soccer team. The national team competes year-round, and I'm the East Coast doctor, and then there's one on the West Coast as well. And I've been working with them now for 5 years. It's a fantastic group of people. I've grown to be friends with many of the players, and it's been a wonderful marriage between my professional career and my love for soccer. I feel like I wear several hats. I'm a coach, I'm a dad, of course, I'm a player, but I think that what sports can teach kids about life is unbelievable. It's a great, great place for kids to learn about how to work together, how to win graciously, lose graciously, delayed gratification, the importance of staying healthy and being fit, just lots and lots of positive lessons that kids don't otherwise get to learn. Regarding my priorities and who I am as a person, the most important thing to me is my relationship with God through Jesus Christ. That is what defines me, and that is what motivates me, and that's what is a daily drive to be all that I can be in the other areas of my life. And then obviously following my desire to glorify God in all that I do is to love my wife, Stacy. Of course, after my wife, Stacy, Luke, Becca, and Jenna, my kids, are extremely important to me. And I'm a very intentional dad. I take great pride in the fact that I believe the keys to life are in relationships. I love being an orthopedic surgeon for a lot of reasons. One reason is that my gift mix that I was created with, I'm very focused and I'm a fixer. I'm very passionate about taking good care of people. I love the relationships that I build with my patients. Fortunately, I'm in a specialty where you actually do fix problems rather than take really bad problems and make them some better. I get to take a bad problem and make it well. And that's a real gift, because then the patients are very thankful, and so the relationship is one that is very gratifying.